So if the goal is to force the insurance industry to bring down the cost, what should Democrats do now? Joining us from Capitol Hill, Democratic New York Congressman Anthony Weiner. Congressman Weiner, thanks so much for joining us. Let me get your reaction to what Mr. Weiner said to Rachel Maddow last night.
Well, he's exactly right. You know, to some degree, we're making so much about the public option, and the health insurance industry is fighting even having the amount of competition just in their exchange for new people getting insurance. Ron Wyden is right. I've come on your show before. I believe there should be a single-payer system for all Americans like Medicare for all. But now what we're fighting over is just having a sliver of competition to get a sense of how hard the health insurance lobby is fighting this. Even that, they're saying, would kill them, which is, of course, not true.
So is this the biggest fear that many have expressed all along, that yes, we will see health care reform, but it will perhaps be meaningless to most of us?
Well, I don't know about meaningless, but I do believe this. I believe that if we are going to cover these additional Americans, we have to make sure they have some choice. And I would like to see every American have the same expanded choices. But the public option is important in one very important reason. If we don't have the public option, then no competition will exist in the bill at all. And that will be a major problem. You know, I have this website, countdowntohealthcare.com, right, and we've been asking people to write in to say they support the public option. We were focusing that on our Republican friends. Now apparently we need to aim it at our moderate Democratic friends who don't even want this to come to a vote.
Real quick, David wants to get in on this, but David, I want to ask Mr. Weiner about the fact that some are saying that if you had to have an option, it's better to have the opt-out than the opt-in, which David and I discussed yesterday, because it makes it more difficult to take away something, and it's perhaps the closest that we would be able to get to a national offering of health care reform.
Well, that's exactly right. I think Harry Reid deserves a lot of credit, but remember what he's done. He's essentially said, I'm going to let the majority decide here. The majority of the country, according to your poll, supports the public option, and all he's asking his colleagues in the Senate is let us have an up or down vote on this. But the opt-out provision is important so long as the public option gets a chance to at least get started so American citizens can have a chance to choose it if they want to.
Congressman Weiner, on the polling that you mentioned, do you think that most Americans realize that the public option would not cover most Americans, that most Americans would not have access to it?
Nope. I think that you're onto something, and Ron Wyden is as well, that a lot of people think that this is this giant transformative health care we're doing. For most people that have their own plan through their employer, like you and I do, we probably won't see much change at all. For people Medicare and Medicaid, they won't see much change. But why the public option is so important is it introduces a little something that we don't really have right now. We have competition between public plans and private plans, and hopefully that'll drive down prices across the board.
All right, Congressman Weiner, thank you very much. We appreciate it. Fascinating debate. The politics will be interesting as well to see how this moves along, both in the House, where Congressman Weiner is, and of course in the U.S. Senate, where we continue to wait for the Congressional Budget Office to come back with a score on the bill that Harry Reid is planning to bring to the floor. Congressman, thanks again. And we want to take